covered mainly the retractors. So this class will cover the forceps, and in the next class some ortho and the neurosurgery instruments. Okay. Okay, so before I begin with this class, let me tell you the parts of a forceps. Okay, last class I think I have said you. These are the rings or the bows. Okay, ring or the bow where I'm holding it. One thumb finger should be there and another ring finger should be there in it. Okay, ring for ring finger. But when there is a single ring, it should be occupied by the thumb. Okay, then is your middle finger, which has to support the weight of the instrument like this. See, the weight of the instrument is over my middle finger, and then this index finger is to guide the movement, fine movement of the instrument like this. Okay, so two rings occupied by the thumb and the ring. Okay, the weight of the instrument supported by the middle finger and the index finger near the joint to guide fine movements of the instrument. Okay, so these are the parts of an instrument forceps. So we'll first move to some clips, towel clips. Okay, this is Doyne's towel clip. Okay, it is different from other forceps in the sense that the action is by pincer mechanism. You see other forceps, if I open it, it opens. If I press it, it closes. Okay, but here in this case, when I press it, it opens. When I leave it, it closes. So this is pincer mechanism of action. Okay, pincer action. So what has happened in this is that there is blades which are curved. Okay, you can see these are the blades. Okay, the two apart after this junction, whatever part is there is a blade over here, and the blades are curved and pointed at the tip, and you can see when closed they cross each other. You're seeing, you're able to appreciate this, that they are crossing each other. Okay, so this is the only instrument where the tips of the blade will cross each other. Okay, and it is used for, what is the use of a towel clip? It is used to keep the drapes in position after painting. So to isolate the operative field from the non-operative field, we are painting and draping that area. So to keep those drapes in position, we are using this towel clip. Okay, so where it is used? Any surgery? All the surgeries it can be used. Okay, it is used in all the surgeries wherever drape sheets are there. What are other uses? Other uses of this clip where it can be used? Yes. When a tongue retractor is needed, okay, when you want to take a biopsy from the posterior aspect of the tongue and you want to retract the tongue, so this can be used to take a, obviously this tongue has to be anesthetized before you apply this instrument, so you can use it as a tongue holder. Okay, you hold the tongue and you can retract it, take a biopsy from a posterior aspect of the tongue. Okay, or the part which is not accessible like that, we can take a biopsy with the help of this. Okay, by using it as a tongue holder. Okay, anything else, anywhere else it can be used? So while operating in laparoscopic surgery, there are camera cables are there, electrocautery cables are there, and also suction tubes are also there. So to hold those things in place also, this can be used. Okay, fine. So these are the uses of this towel clip. So this is Doyne's towel clip. There is another towel clip, but which doesn't act by pincer mechanism, but it is just like a forceps. This is also a towel clip. What is the name? Buckhouse. Okay. So you can see it. The blade is split into two fang-like things. You can see it. So when it's closed, they just approximate each other. Okay, without crossing each other. Okay, so there is this Buckhouse towel clip, the same thing, but it cannot be used for retracting the tongue. Okay, so you'll unnecessarily injure the tongue in two areas, which otherwise could have been done at a single point. You can see the two areas it'll get actually injured. Okay, so it is used to, main function is to hold the drapes in position, and other things like suction tube, electrocautery cables, and the camera cables while doing laparoscopic surgery. Fine. Okay. Then comes this. Okay. So are there two rings? Two rings are there. This is the, sorry, I forgot to say, this is the lock or the ratchet. Okay, and this is the shaft, this is the blades, and this is the joint. What type of joint it is? Box joint. Okay, so there are few instruments which don't have a box joint, but they have a pivot joint. Okay, we'll see those instruments also. And the blades is almost half of the length of the shaft. You see the length of the blade? It is half of the length of the shaft. And the inner aspect of the blade, you can see multiple transverse serrations are there. Okay, and when you close this instrument, you see that all those serrations, they fit to each other, and it is almost occluded. Okay, so it is used as a hemostatic forceps, hemostatic artery forceps. Now there are various sizes and various, depending upon the curvature, it can be straight artery forceps or curved artery forceps. Okay, sizes are small, medium, and large. There is a very small artery forceps, which is also called as mosquito forceps. Now, why it is called mosquito forceps? Yeah. Yeah, the bite of that forceps over the skin resembles the bite of a mosquito. And another thing is that it is so fine that you can hold the proboscis of the mosquito. That is why it is called a mosquito forceps. Okay, what are the uses then? Yeah, any bleeding points are there while giving the incision or while doing any intra-abdominal surgery, where there is any bleeding vessel, so that can be held with this hemostatic forceps. Okay, the advantage of the curved is that it doesn't occlude our vision while you apply this forceps. Okay, now so I'm applying it over here. So while applying it, what happens is that if I'm doing it in a straight line, what I'm holding it, I'm slightly not sure. I'm applying it with an estimation that okay, it is at this depth. Okay, but when I have a curved artery forceps like this, okay, when I'm applying, I can see it through one angle that I am applying the structure. So that is the advantage of curved artery forceps. Okay, it can also be used in dissection. Okay, particularly the mosquito forceps one, it can be used in dissection while doing fine surgeries like thyroidectomies. And the larger one can be used when you are doing it in depth. Suppose say cholecystectomy, or you're doing any pelvic surgeries like anterior dissection or abdominoperineal dissection. The larger one can be used in that condition. Okay. Otherwise, all the medium sizes can be used in anywhere superficial or deep areas wherever any bleeding is there, to catch hold of it, to crush it, or to even tie it. After that, after catching hold of it, you can put a tie, or you can leave it like that if it is just getting stopped after a few minutes of crushing. Anywhere else, any common surgeries where it is used to crush something? Yeah. Sorry? What's the resection? Appendicectomy, yes. Where it is used to crush? Base of the appendix, yeah. So before we put a suture at the base of the appendix, so that the suture doesn't slips, we can crush that part and then take a suture over there. So the suture, what happens is the area which gets crushed, that will get depressed, and so the suture won't slip above and below. So that is the advantage. Okay. So we can crush the base of the appendix with this artery forceps before putting the ligature. Okay. So the identification is that the length of the blade will be almost half of the length of the shaft. There will be a ratchet and there will be transverse serrations in it. Okay, you are able to appreciate this transverse serrations on both the blades in a respect. And when you close this instrument, there will be no space in between the blades. It will fit to each other. Okay, and this is the straight. Okay, straight and curved. Okay, everyone clear? Yeah. A similar instrument, this one you can see, but yeah, there is some difference which has made it as coccus forceps. What is the difference? There is a tooth at the tip of one blade which fits into the groove of the at the tip of the other blade. Okay. So thing is that this cannot be used for dissecting fine tissues because of this nature, but the hemostatic wherever hemostasis is needed, there it can be used, particularly larger vessels, pedicles like splenic artery, renal artery. The advantage of this is that it locks and the possibility of slipping out is less. That is why this groove and tooth is there. So what is that? Once something has been caught with this, okay, it will rarely slip by accident. Okay, so it is very secure. But thing is that there should be no tissue in this area. If some tissue is there, that is going to get damaged. Okay, so it is only that vessel what you're going to ligate, only those tissues has to be held, and the tip should not be containing any tissue in it. Any other uses? So it is used in any abdominal surgeries, particularly before ligating any vascular pedicles. Any other surgery apart from this hemostatic role? Yesterday someone was saying regarding some uses in gynecology. Okay. Artificial rupture of membrane. Apart from that, it can be used to hold tough structures. Okay. While you are giving an incision where you're opening the abdomen, the rectus sheath can be held. The linea alba, you're going to open it. So two coccus forceps can be applied to two margins and this can be lifted up. Okay. So one here, lifted up so that you can open the abdomen. Okay. So while closing the incision, while opening the abdomen, these can be used. Fine. And anywhere it can be used. Yes. Resection and anastomosis. Okay. So when we do resection and anastomosis, say a bowel, small bowel. So we will be going to apply. There is a part of the bowel which has to be removed. Okay. So now there is a chance that if you don't put these clamps, there will be spillage of if you cut the bowel directly, there will be spillage of contents into the peritoneal cavity, which we don't want that to happen. So what we'll be doing is that okay, suppose this is a segment of bowel, okay, and we want this part to be removed. You imagine that this is continuous on this side as well as on other side, and we want this to be removed. Then what we are going to do is okay, the part which has to be saved, this other clamp, this is called a occlusion clamp, intestinal occlusion clamp. This has to be applied on that part, and the part which is going to be sacrificed this has to be applied in that area. So this part is going to get sacrificed. So I apply this one over here, and on the other side, intestinal occlusion clamp and cut in between. Similarly, here also we are going to put one more coccus forceps, and on the other side an intestinal occlusion clamp and cut in between. Okay. So while doing a resection anastomosis, we need 2 intestinal occlusion clamps and 2 coccus forceps so that that segment of the bowel can be removed. Okay. So that is another use. Anywhere else it can be used? Any other gynec surgery? McInrod's ligament. What is that? Huh? Okay. So it contains some vessel in it. Uterine artery. Okay. So while doing a hysterectomy, there are some 3 clamps, as I remember. In that, the second clamp is for the McInrod's ligament. So we can put this clamp, and after cutting it with this clamp, after that we can tie it. Okay. Let's take a call. Yeah, Thiru. Okay. Okay, so that was a straight one, and we have another curve. And this one is the curved coccus forceps. Okay, you can see the tooth and the groove. Okay, so this is a curved one. Okay, the advantage is the same, like you can have a vision of what structures you are clamping. Okay. Yes, what is this? Alice tissue forceps. Okay, it's a traumatic or atraumatic forceps? Atraumatic or traumatic? Traumatic. It can cause trauma. Okay, you can see there are teeth. Okay, at both and they will fit with each other when you lock the instrument. Okay. The identifying other features are that the blades are parallel to each other, and when you close it, there will be some space in between. Only the tips will be approximated. So whatever structure is there at the tip, that will get injured. So it should be a tough structure. And whatever the tissues are there within this blades, that won't be injured. Okay. So where it is used then? So it is used to hold tough structures. That is a use. Any surgery? Yeah. Yeah. So while doing a laparotomy, it like the coccus forceps, this instrument, this Alice tissue forceps, can be a replacement for that. Okay. So it can be used to hold the rectus sheath on both the sides before we open the abdomen. Also, while closure, it can be used to hold the corners or the angles of the incision before taking the first bite. Okay. So everyone got it? This is Alice tissue forceps. What are the other uses? Sorry, I forgot the sterilization. All the instruments are sterilized by autoclaving. Okay. Today, what are instruments you are going to see? All these will be sterilized by autoclaving. Fine. Yeah. So what are the other uses? Now you don't have a towel clip. Can this be used as a towel clip? Yeah. So this can be used as a towel clip also. Whenever you're doing and raising a flap, say in MRM, in thyroidectomy, to hold the flap, since skin is a tough structure, that is why this can be used in that. While raising flaps, while doing surgeries like thyroidectomy, MRM, Okay. Anywhere, anything else this can be used for? For doing surgeries like for incisional hernia, there also flaps are to be raised so that above the anterectal sheath flaps has to be raised so that we can put a mesh. Okay, so this will be the flap will be held with this instrument. Okay, and we'll be lifting up the flap like this so that we identify the plane in between the anterectal sheath and the subcutaneous tissue. Open that plane, create a space of around 3 to 5 centimeters around the defect, and put a mesh. Okay. Any other use? In gynec, it can be used. Where? Yes. To hold the cervix. Okay. It can be used to hold the cervix. Okay. Yeah. What is this? Okay. So everyone knows the name. Fine. So half marks everyone will get. Okay. So how did you identify it as Babcock's forceps? Yes. Okay. So it has also got two rings, ratchet and shaft, box type joint, and the blades. Okay, which are like curved at the tip. Towards the tip, they are curved and also fenestrated. You can see the fenestration. So the fenestration and curving of the tip helps in holding tissues. So in between this, suppose any tissue is like this, I can hold it like this. You can see that. Okay. So whatever is there at the tip, that may likely get injured, but the tissue which is there within the curved parts of the blade, that will be uninjured. Okay, so it is an atraumatic forceps. For that reason, it is an atraumatic forceps. Okay, and a fenestration keeps the instrument light and also helps gripping the tissue better. So what will happen is that if some tissue is there, you have held it like this. So through the fenestration, it may bulge out. Okay, so without getting injured, it may bulge out through this fenestration, and this will help in slippage of that tissue, whatever you are holding it. Okay, so it is used to hold what? Delicate structures. That is the use of this instrument. With surgery? Okay, to hold the appendix in appendectomy. Anything else? Yeah. Spermatic cord, no, we don't. There is a separate instrument for that. Resection anastomosis, okay, fine. We usually use a clamp for resection, but to keep the edges close together, we can hold this instrument. Whenever a bowel is there, the bowel margins can be held with the help of this instrument. Anything else? Ureter, yes, good. Then any other tubular structure? Fallopian tube, yes. Then any other similar structure in the abdomen? Okay, any structure which has got a mucosa, it can be held with it. But what will happen is that it will hold only, we won't be holding the bile duct within this. Okay, we'll be holding the margin of the bile duct. Suppose you're doing a coldocoduodenostomy. So with that, what will happen is that it is likely to injure it. So we don't use this. If you are using also, if you just for some 1-2 seconds to lift up, we can hold it, but you have to release it immediately. Any other tough structure in the abdominal cavity which is lined by mucosa, contains fluid? Bladder. Okay. So when the bladder is injured, to repair it, the margins of the bladder can be held with this instrument. Okay. Fine. That is a tough. So it is going to hold with this tips only. So it's likely to get slightly injured. But since bladder is a tough structure, it can be held. Okay. Apart from that, it can be used to hold bowel, be it stomach, small bowel, or large intestine can also be held with this instrument. Okay. And when you don't have a towel clip, it can be used as a towel clip also. Okay, but this will damage the instrument, but it can be used for that also. Okay. Yeah, another thing is that when you're doing a lymph node dissection also, this will be helpful. The lymph node will be trapped within this, the groove formed by the curvature of the blade, and so that you can give some retraction while you do a lymph node dissection. Fine. Sterilized by autoclaving. Yeah, what is this? Huh? Okay, anyone? Ovum forceps. Apart from that, anything else it can be? So ovum forceps has got this tooth, doesn't have this tooth. Okay, and it will be long also, and it will be lighter. You see how broad the blade is. Huh? So it has also got the same rings, ratchet, shaft, box type joint, and the blades are short and stout, curved and fenestrated. Fenestration and curvature are for the same things, to hold the tissues without damaging them and to have a good grip. And there is a tooth at the tip which fits into the groove at the tip of the other blade. So this is traumatic. Okay, but it can be used to hold more thicker structures than that could be held with the Alice tissue forceps. So can anyone guess any other example? That is why we are Alice forceps are used to raise only skin flaps, but this can be used to hold. Yes. Okay, rectus can also be held. Alice also can be used to do that. That is more easier. Anything particular you see that the larger amount of tissue can be held with this? You can see there is a large space after closing it. Breast tissue. Okay. When you're doing a modified radical mastectomy, when you are dissecting the breast tissue along with the pectoralis fascia, okay, from the pectoralis major muscle, this can be used to hold the breast tissue, and then you can, with the help of a cautery or a knife, you can create the plane in between the fascia and the muscle. Fine. It can also be used as a towel clip if a towel clip is not there. Okay. Sterilized by autoclaving. Fine. Oh, sorry. Lane's tissue forceps. Huh? Okay. Yeah. Now this is one instrument that is a single ring. So single ring has to be occupied by the thumb. So if I try to hold like this, is it okay? So this will be asked in the question how we have to hold this one. Okay, so it has to be held like this. Okay, thumb and the one of the ring which is open and is like a hook is to accommodate all the other four fingers. So what happens is that while doing it is a cystolithotomy forceps. Okay, so this is while for removing a stone from the urinary bladder. Okay, by open technique, not that we are doing a cystoscopy. By open technique, we are opening. So this one, imagine that the patient is like this. Okay, and from this is the leg side is this side. So from the leg side, you have to, after opening the bladder, this one has to be inserted. You have to sound where the stone is, hold the stone and remove it like this. Okay, so that is why it has to be held like this. From above we can't insert it. It has to be held. Somebody has to be on the lower end of the patient, and if the patient is like this, it has to turn like this. Okay, the symphysis pubis will be there. So at the superior border of the symphysis pubis, it has to go down. That is, everything will be under vision only, nothing blind. Okay, the bladder is opened, and then after giving an incision and the bladder is open, and then you sound the stone. So the stone may not be visible with a small incision, so you have to sound the stone where it is, like wherever you feel some gritty sensation or some hard feeling is there, apart from the usual firm consistency of firm or soft consistency of the bladder, that will be the stone. You try to hold it and you take it out. Okay. What is the advantage of making it such an instrument? Ratchet is not there, so it will help in preventing inadvertent crushing of the stone. Suppose if a lock system is there, say like this, okay, it is not that it will close over here, it will close only when it is like this. So this will cause crushing of the stones. So that is why wherever stones are there, say it a Desjardins forceps also, we don't have any ratchet in that. Okay. So to prevent crushing of the stones, there is no ratchet. Now there is another unique feature, that these blades are flattened and cupped, and you can see some fine serrations. Here some fine serrations are there, and on this side also you can see some fine serrations are there. So this is for good grip of the stone. To have a good grip of the stone, this instrument has been modified. One is like it has been cupped, the blades have been cupped, and there are fine serrations, and there is no ratchet. Fine. Surgery is for removal of bladder stone by open cystole, that is open cystolithotomy, and sterilized by autoclaving. Yeah. We'll go to another instrument which has got no ratchet. This one. Yes, what is this? You can see the tip, and when I'm approximating it, it is also not fully approximated except for the tip. Yes. Okay, so Desjardins will be a curved. Okay, that we have kept for postgraduate examinations, because CBD exploration we ask them. This is straight one, that is called sinus forceps. Lister's sinus forceps. Fine. Okay. So it has also got two rings, but there is no ratchet in it. There is a box type joint, and the blades are straight, and they don't approximate each other except at the tip, and the tip has got some transverse serrations. So except at the tip, the rest is not approximated when you close the instrument. So where it is used for? What is the name? So where it is used for? Yes, exploration of sinus tract. Okay, so there is a sinus, you just want to see if there is any foreign body in the sinus, or where is the sinus going, from which part to which area it is going. So you can use this as a sinus for exploring that sinus tract, and also for dilating the sinus tract, so that if any collection is there, that can be drained. Apart from that, any other important use? What is Hilton's method? Okay, any abscess drainage wherever you feel there is an underlying neurovascular structure. So to avoid injuring that particular neurovascular structure, we do two things. One is move this instrument parallel to the direction of those neurovascular structures, and another thing is we have to, whenever we insert it, break the abscess cavity, we don't close it again. We have to withdraw the instrument in the open condition. Okay, that is Hilton's method of abscess drainage. So to break the laculi in case of abscess, the method is you thrust the instrument into the abscess cavity, open it, that way breaking a laculi, then withdraw it without closing, withdraw it in the open condition. Okay. In that way, you are trapping any neurovascular tissue. If you close it again, it's possible that you will trap that tissue, and when you pull it back, you're going to avulse it. Okay, got it? So that is why also only the serrations are there in the tip. So why they have made serrations in the tip? No, loculi will be broken just by thrusting and opening up this one. So what is the need of putting serrations on the inner aspect? Now if it's open, that's a large abscess cavity, you are able to see in the depth what is there. So what we can do is that this any slough that can be held with this, you have to be sure that there is no neuromuscular structure in it. If any slough is there, that can be held and can be extracted out throughout the abscess cavity. Okay, sterilized by autoclaving. Sorry. Yeah, so that was Lister's sinus forceps. Okay, so this one I have already said what it is. Yeah, what is the name? Intestinal occlusion clamp. It is a non-crushing clamp. Okay, the one which we used for on the other side of the bowel for resection anastomosis was coccus forceps. That was a crushing clamp. So when it is closed, both the surfaces of the blades, they approximate each other. But here you see it is not approximated at all. And even while putting maximum also, it is not crushing or opposing each other. Okay, it's a very long instrument, light instrument. Okay, and the size of the blades will be larger than the size of the shaft. Can you appreciate it? The length of the blade will be longer than the length of the shaft. Okay, and the ratchet also will be longer as compared to other instruments. See this ratchet? This is longer as compared to other instruments. And what else you can see on the inner aspect? The blades will be slightly flat, and on the inner aspect you can see serrations, and the serrations are can you see that? Longitudinal serrations. Okay. Okay. So this is just to occlude the lumen of the bowel. The idea is not to injure the tissue, but just to occlude the lumen so as to avoid any spillage of the contents of the bowel while doing any anastomosis or resection and anastomosis. Okay, fine. So it is used only in resection and anastomosis or any kind of anastomosis. Okay, sterilized by autoclaving. What is this one? Sponge holding forceps. Okay. So what we can do is that we can hold a gauze piece at the between the tip of both the blades. Okay, like this. A gauze piece will be held over here, and this can be used for painting the area or the skin before giving before any surgery. So that is the main use of this sponge holding forceps. Okay, so any surgery, all surgeries it can be used. Okay, apart from that, it can be also used for holding the in gynec it can be used to hold the cervix. Any condition where it can be used to hold the cervix, particularly Alice can also be used to hold the cervix. Pregnant, yeah. So in pregnant woman, this can be used to hold the cervix. It is less traumatic. In pregnancy, the cervix becomes more friable, edematous. So in that has to be Alice tissue forceps is to be avoided. Fine. Yes. Anywhere else it can be used. So when you are doing surgery in the abdomen, there is some area which is deep and you want to mop that area. Suctioning can also be done to clean the secretions or fluid in that area. Another thing is that you can put a sponge over there and put it into that area and mop it, clean it. Okay. Other thing is whenever there is any bleeding from any cavity, suppose in a thigh there is a blood is coming out from that, or in the abdomen also anywhere is there which is not under the reach of your hand, we can put a take a gauze piece in this forceps and pack into that cavity. Okay, so that is another use of this sponge holding forceps. Anywhere else it can be used? Two sponge holding forceps will be needed in that surgery. What is that surgery? Usually commonly performed surgery. More common in northern India. Cholecystectomy. Okay. So usually two forceps will be taken. One is used to hold the body of the gallbladder, and the other forceps will be used to hold the Hartmann's pouch. Okay, so that we can give traction outwards and downwards. Traction is given outwards and downwards so that the cystic triangle or the cholecystectomy triangle opens up, and we can do dissection. Okay, so that this is what you may be asked: how is the traction given? Outwards and downwards. Where is it applied? One in the body or one in the fundus? Exactly, it's in the fundus. One in the fundus and other in the Hartmann's pouch. Fine. Sterilized by autoclaving. Good. Yeah, what is this? Yeah, scissors, everyone knows. Name. So there are two scissors you'll find usually. One is what you're saying is Metzenbaum, but this is not that. And the other one is Mayos. So this is that Mayos scissors. Okay. So how to differentiate that? Metzenbaum will be lighter. Okay, you see, and it will be thinner. So helpful in doing fine dissections, cutting fine tissues. Whereas this Mayo scissors will be heavy, broader, and so used to cut tough tissues and also sutures. Tough tissues like your rectus sheath can also be cut. So when previously cautery was not there, we were using these Mayo scissors to cut the rectus sheath. The external oblique aponeurosis can also be cut using this. Any tough structure can be cut with this scissors. While doing surgery, if you find any tough structure, apart from the bone, this can be used to cut it. Okay. So yeah, sutures also it can be used to cut it. Sterilized by autoclaving. Fine. Yeah, this is. So you see the ratchet over here is very small. It is just confined to the shaft only. There is no projection anywhere else. And the blades are curved so that they form a ring-like thing. And there is one projection in one of the tip of one, and there is an opening in the tip of the other. So when you close it, the projection fits into the depression of the tip of the other blade. So it is a hernia ring. Okay. So or we can create as a cord ring also. So while doing hernia surgery, what we to lift the cord structures, this can be used. After dissecting you should have lifted the cord structures initially with your fingers, and then to use an instrument for manipulation, this can be used. So cord structures will be something like this along in the hernia. So what we can do is that after you lift it up, this can be applied, and this can be used for manipulation of the ring, so that you can dissect the sac completely from the inguinal canal away from this cord structures. Okay, so that is the only use. Can also be used as a towel clip. Okay. Nowadays we are not using these things. We take any umbilical tape. Okay, any tape can be used. Even a gauze piece can be used in place of this. Okay, sterilized by autoclaving. Yeah. So this is also another forceps. Okay, here you can see there are transverse serrations just like the hemostatic or artery forceps. Both the sides, there is no tooth at the tip, and when you close it, there is no space. Okay, but it is not. It is very slender and it is also lightweight, and the ratchet is also not that big except for the width of the shaft. Okay, it is a Robert's forceps. Okay, so if you are want to achieve hemostasis at a depth, instead of using a large artery forceps, this can be used for insertion of drains into the peritoneal cavity. What we do is that we thrust into the abdominal wall from inside outside, then come outside, hold the drain, and then we pull it back. So the drain from outside enters into the abdominal cavity through an opening. So for insertion of the drain, for achieving hemostasis at a depth, this can be used. Okay. So what is the name? Robert's forceps. Okay. Fine. So this one everyone can identify. It is similar to artery forceps, but it is very long and it is slender and lightweight as compared to artery forceps. Main function is for the insertion of the drains. Apart from that, if it at a depth, it can also be used as a long artery forceps. Fine. Sterilized by autoclaving. So we move on to the last instrument. Okay, this is also very important. So needle holder. Okay. So how did you identify it as needle holder? Okay, and in center there is a groove. Okay, the inner aspect of the blade has got a groove, but it is not that in all needle holders the groove will be there. So this may be absent. Anything else? What you saw? Short blades. Yeah, the crisscross serrations is the identifying characteristic feature of a needle holder. Okay, the groove may not be there in all the needle holders, but crisscross serrations will be there. Presence of a groove improves the grip of the needle. Okay, but when it is a very fine needle, suppose 5060 for eye surgeries, there may not be presence of groove is not needed. Presence of crisscross serration is sufficient to achieve that grip, and we can use those needle holders also when you're using very thin needles. When a larger needle is there, the groove helps in achieving a better grip over the needle. Okay, and the length of the blade, what you notice over here, is 1/5 of the length of the shaft. Not exactly, but it is around 1/5 of the length of the shaft. You can see it. That is a blade and that is the shaft. It is almost 1/5 of its length. Okay. So now there are more questions with this particular instrument, like how will you identify it? And second thing is that how are you going to hold the needle? Where are you going to hold the needle? So where is the needle held? 1/3 and 2/3, but from where? From the swedge end 1/3, and from the tip 2/3. Fine. Okay. Okay, fine. So it is also sterilized by autoclaving. Okay. So the function is to hold the needles while suturing. Even if needle is not there, while knotting also we can use this needle holder. Okay. Knotting can also be done with the help of an artery forceps. If needle holder is not there, or if the needle holder is bulky, when you are doing fine knots or small knots, that time mosquito forceps or a small artery forceps can also be used for knotting. Okay. Yeah. Sterilized by autoclaving. Fine, then we have completed all the forceps. There were some few other forceps. I think they have missed it somewhere. This Metzenbaum scissors was also there, and okay. So the Metzenbaum scissors will be lighter than this one, and the tip will be pointed and will be lightweight. It won't be broad, it will be slender. So which will be helpful in fine dissections. Okay, so if you get it in exam, you should be able to differentiate. But most likely you'll be getting these instruments only. In case that is added, you can remember it. Okay. So you can come in batches and just see the instruments.